We're at 8:32 and have almost 50 people on the line, so I think we'll start and people will join in. So good morning, everyone. Welcome to Grand Rounds. I have the pleasure and privilege of hosting Grand Rounds this morning in Dr. Chakraborty's absence. And delighted to introduce our speaker today, Dr. Gary Goldfield. I'll begin first with our land acknowledgement. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis peoples and their valuable past, present, and future contributions to this land. So this morning, it's my pleasure to introduce our speaker, Dr. Gary Goldfield. Gary is a senior scientist at the CHEO Research Institute and a member of the Healthy Active Living and Obesity, the HALO Research Group. He's a full professor in the Department of Pediatrics, the Faculty of Medicine at University of Ottawa, and cross-appointed to the Schools of Psychology, Human Kinetics, and Population Health at University of Ottawa. Gary is a registered clinical psychologist who practices in the community, so he's a true clinician scientist, providing clinical care as well as doing research, and he sees children and adolescents and adults in his practice. He was one of the founders of the HALO group back more than 17 years ago. His research has been supported by CIHR and SSHRC, as well as many other national and provincial government agencies. He has also partnered with industry, including pharma and technology. His focus has been on evaluating novel behavioral and pharmacological interventions for the treatment and prevention of childhood obesity and related health complications. He is internationally recognized for his research examining the effects of screen time and physical activity on health and mental health in children and youth, something that's very relevant today in our post-pandemic era. He's the author of an ongoing blog for Psychology Today magazine focused on the impact of screens on mental health in youth. He's published more than 180 peer-reviewed manuscripts in medical and behavioral scientist journals and has more than 175 scholarly conference presentations as published abstracts. Despite all that, Gary is very humble about all of his accomplishments and has a neat title for his presentation today, No More FOMO, Effects of Limiting Social Media Use on Mental Health. I will turn it over to Gary. I unfortunately have to leave partway through rounds this morning, so Dr. Norris has graciously agreed to facilitate the Q&A. So over to you, Gary.
Thanks, Jason, for a very nice introduction. So most of you know me, as Jason alluded to, as a pediatric obesity researcher, and I started my career in eating disorders. But the last few years, I've really, probably last 5 to 10, really dove into the social media literature, looking at the effects of health and mental health. So I'd like to share some of our work today, but just set the stage and hoping you'll understand that at least that there is a causal role for social media in the development of mental health issues in youth. So a brief outline. So we'll just talk a little bit about youth development and vulnerability during adolescence, vulnerability for mental health, some of the driving forces behind social media use, a little bit of social media use epidemiology, and then review the relationships between social media use and mental health, identify some vulnerable subgroups, and then review some short-term RCTs on social media abstinence reduction on mental health. So that's our highest quality of research, of course, looking at a causal link, and then present our recent contributions, and of course, finish up with summary and conclusions. I think most of us know, working at CHEO and working with children and youth, that adolescence a critical period for mental health. And that's largely believed to be driven with evidence to support that it's a high-risk period for mental health issues due to rapid changes in physiology, the social setting, social interaction, physical development, and psychological changes. And approximately 80% of adult mental health disorders have their origins in childhood. There's also contributing to the vulnerability is there's a heightened need for social connection with peers, social acceptance, and social approval. It's also a heightened need or a heightened sensitivity, if you will, to social criticism and social rejection. Peer influences and attachment become stronger than in any other life period. So with that vulnerability, it's not surprising that mental health is a very serious problem in adolescence. We're facing a crisis, and the pandemic only exacerbated that crisis. Here are some grim stats. 20% of youth will be diagnosed with a mental health disorder. Depression and anxiety, of course, are the most prevalent. COVID-19's exacerbated this crisis. A recent study found in the Canadian Community Health Survey, it's a national longitudinal representative sample of youth, 36% of youth age 15 to 24 and 23% scored above the clinical cutoffs for depression and generalized anxiety disorder. 14% of Canadian youth report suicidal ideation, and 6% have made at least one attempt. So what's paralleled this spike in mental health issues and the crisis is the rise of social media. And it sparked a lot of research into the mental health effects of social media. So it's interesting that the definition of social media as it changed and evolved with technology, of course. So before 2010, it was essentially a tool of connectivity for people with common interests. And now, of course, it's a tool for creating and sharing content. So back then there were no pictures or very few. It was more dialogue, and now, of course, that has completely exploded with influencers and thousands of followers. So here's the context, the social media landscape. So down here, humans are inherently hardwired for social connection. Social reinforcement is extraordinarily powerful. I've just described it's even more heightened in adolescence. The current design of social media, you probably are aware of some of the lawsuits happening in the US and more recently in the Ontario School Board, that these big tech is intentionally designing social media to be reinforcing. It's got an intermittent schedule of reinforcement, which holds users' attention and keeps them coming back, creates a strong fear of missing out. Of course, there's easy access. We live in a screenogenic environment. 95% of youth in Canada own smartphones that have access to the internet and social media. And of course, you've got the vulnerability of youth, all converging to drive high social media use. So other digital drivers that I mentioned, the fear of missing out, the need to belong, and of course the constant updates. And what you get on social media is not only high use, but people are spending an inordinate amount of time curating their profiles. They'll take dozens, if not hundreds, of selfies looking for that perfect angle and filters, and you see a lot of photo edited pictures. And people generally overrepresent the positives in their life, and of course, don't share much of the negatives, which breeds unfavorable social comparisons. So looking at, this is an American epi study by the Pew Center. Look at this, the main reason that youth are using social media is to share their accomplishments. And then closely followed by connections with family, sharing their emotions and feelings. Some people use it for dating. And almost one third, reported using social media for none of those reasons. So clearly we have a fair bit of work to do on figuring out the drivers and the motivation for social media. But accomplishments seem to be number one. So we know from now they're doing a lot of research looking at the neurobiological mechanisms and effects of social media, and now with there's been some neuroimaging studies, some nice prospective studies. So we know social media, getting these messages and anticipating messages, the anticipation of social rewards provides a pretty substantial dopamine hit. And of course, dopamine is the neurochemical that modulates reward. So it's stimulating the brain reward system. As I mentioned before, these messages come frequent, but in an intermittent or unpredictable schedule. And that keeps people tied and can promote addiction. Most of the use in social media is scrolling, or what we call passive use, and it's endless. There's endless images if you have a large following. And of course, as I alluded to before, the big techs are making very aggressive algorithms, and that's been implicated in all kinds of mental health disorders and eating disorders as well. So if someone wants to look up healthy lifestyle, or maybe how to lose weight, even in a healthy way, they're going to be every day. They're going to be fed with all of this dieting-driven content that is harmful to body image, and of course could elicit disordered eating. So let's just take a look at the prevalence of social media. So we all know, I'm not going to spend a lot of time. We all know that kids are spending a long time. This is an American study. So this is pretty much a daily use. The main ones seem to be TikTok. YouTube is starting to come on strong. Snapchat's a big one, and Instagram and Facebook. So you've got almost 20% of teens showing that they're using these platforms constantly. They're online almost constantly. A pretty significant trend is you'll see girls tend to use social media more than boys. This is basically showing the same thing. So looking at some Canadian data from the Ontario Student Drug Use Health Survey, led by Haley Hamilton out of CAMH. So our group, our HALO group, Dr. J.P. Chaput and Mark Tremblay and myself have published a lot of papers from this. And so you could see that the vast majority, over 80% of males and females, are using social media for at least more than 2 hours a day. And half of females are using more than 3 hours a day. Keep in mind, this is based on self-report. So chances are they are using more than these stats. So I will allude to problematic social media use. That's getting more at addiction. So difficult, not only high use, but there's some interference with family, with friends, with school. There's some withdrawal effects of anxiety or distress when prevented from using, and a strong desire to use. So there are a bunch of different problematic or social media addiction scales. And this is the data from the Health Behavior Schools study, and with almost 20,000 youth. So this one was showing actually one of the lower rates of problematic use, about 8% in females and 5%. I've seen it as high as 30%, depending on the scale and the sample. So let's look at the relationship between social media use and mental health. There's plenty of evidence. So there have been many systematic reviews done. So I'm going to present some data from these reviews. So depression is by far the most researched outcome or correlate of social media use. Dieting, there's plenty of literature on dieting. Cyberbullying, of course, one of the main mechanisms for causing harm, psychological harm. All called psychological problems, 20%. Sleep is a strong correlate and also shown to be a mediator on its impact on mental health. And then I don't know why anxiety is not, why it's separate from psychology problems. Body image And then, of course, you may have heard of sexting and sex-related issues. So mental health is at the top of the list. So I'm going to just present some data from some pooled analyses from meta-analyses on social media and depression. So there have been many studies, and when you look at the overall population, when all pooled, the effect is pretty small. So greater social media use is associated with greater standardized depression scores, but you'll see that the effects are pretty small, 0.12. But looking at problematic social media use, effects become overall pooled effect becomes much larger at almost 0.3. And then looking at anxiety symptoms, the pooled effect is 0.35 standard deviations. So that's still somewhat small, getting into the the moderate range. Same trend with stress. So many may have heard there have been some deaths, some suicides that have been attributed to social media use, and so there's a emerging literature on social media use and suicidal ideation and attempts. I don't know if you can see this well, but I'm just going to review it. This is a paper that that we did. Fatima Mughrabi just published it, hot off the press. We just sent the proofs back yesterday. And so generally in the literature, as I'm going to get to, we know females use social media more, and they're more negatively affected. The relationships with mental health are stronger. But our study showed, at least with regards to suicidal ideation and attempts, the exact opposite pattern. So this is problematic social media use, and this data came from the Ontario Haley's Ontario Student Drug Use and Health Survey. So those who reported moderate serious symptoms on this problematic social media scale, males were 3.7 times more likely to have suicidal ideation and 6.25 times more likely to make an actual suicide attempt. That is a scary statistic. So some of the longitudinal studies have examined bidirectionality and have found it. So it seems like social media use and problematic social media use does lead to mental distress, but mental distress, feeling anxious or depressed, also leads to greater problematic social media use and just higher use in general. Why? There's some literature to suggest that when you're depressed or anxious, you're not as engaged in life, you're hanging around the house more. And what do people do what do youth do when they're home a lot? Is they're on their screens and they're on social media, trying to feel a connection, trying to see what's out there. So this is a burgeoning field. It's interesting when you look at social connectiveness and isolation. Most of these stats are going to be pre-pandemic. Of course, the pandemic has exacerbated this. So I've described in adolescence strong peer. We know working with youth that strong peer relationships are strong risk and protective factors for mental health. And despite constant digital connection, 25% of Canadian youth feel lonely and socially isolated. Youth from lower SES families or underserved youth from racialized or ethnically diverse youth are twice as likely to feel lonely. Although single studies show that social media use is related to increased social connection, meta-analyses show it's associated with higher loneliness in both children and youth and adults. And again, you see from longitudinal studies evidence of bidirectionality. So social media use can lead to further loneliness. Loneliness can drive or motivate social media use in search of a connection, but they're not finding it. So this is a busy slide. It's investigating the relationship between in-person versus online social relationship satisfaction and relationships to social support and well-being. And this was looking at Facebooking in young adults, I think university students. And it's a busy slide, but main takeaways is, as you'd expect, there's a trade-off here. So the more time you spend on Facebook, you are more likely to have online social relations satisfaction, but that's not very predictive of psychological well-being. And there was no relationship to actual feeling social support. So you might be happy with social relationships online, but you're not deriving any social support. And the greater Facebook use is associated with reduced offline or in-person social relations satisfaction. And those with higher satisfaction with social relationships, of course, that buffered the effect on social anxiety. They felt less socially anxious, and social anxiety was inversely, of course, associated with psychological well-being. Look at the beta weight between in-person social support, social relations satisfaction with your in-person relationships, 0.52 with social support. So this clearly shows that online, whether you're satisfied with social relationships or not, you're not deriving any social support. Whereas in person, you're deriving a ton of social support, and that is protective. So clearly, the takeaway here is online social support is really insufficient, and it's really the in-person social relations that lead to social support. So basically, we should be investing in greater connection offline and in person than online. There's been a lot of most of the research looking at pathways, unfortunately, has been cross-sectional. There have been some longitudinal studies. And as I alluded to before, our group, with JP Chaput and his student Oog, has published many papers on cyberbullying, and that's a mediator of the effects of social media on depression and mental health. Sleep is a big one too. Social media use displaces sleep. And of course, we all know how important sleep is for depression. Online harassment or cyberbullying has led to poor body esteem and body self-esteem, which impacts depression and emotion regulation, disordered eating, anxiety. And of course, there's some interrelationships here. So those are probably the most studied mediators. Social comparison, of course, is a big one. So in summary, just looking at most of the correlational observational studies, almost all of them, when you're looking at meta-analysis, show that greater social media use or problematic use is associated with lower well-being, lower life satisfaction. And I didn't review all of this because we don't have time, but those are the positive psychological indicators, and the negative ones show actually stronger relationships. So stronger relationships with anxiety and depression and suicidality, cyberbullying. There's a pretty strong literature also to support body image that should read satisfaction. As well as there's literature to suggest, and neuroimaging to suggest that it's associated, greater social media is associated with poor executive functioning and poor academic performance. And that's actually an area I'm starting to focus on with my RCT research. There are some main theories of how and why social media impacts mental health. Social comparison theory, that's more of a content-driven theory that elicits these social comparison processes. Cyberbullying and negative online experiences, as I've mentioned, is a big one. It's not really a theory, but displacement hypothesis, also, which is very similar to behavioral economic or behavioral choice theory, is a big one. It's important to note that most of these theories are not mutually exclusive and likely additive, so they're all likely exerting an impact. So social comparison theory, this is not a new theory. It was posited by Leon Festinger in the 50s. and it posits that individuals possess a fundamental drive for self-evaluation. Of course, as I alluded to before, this drive is heightened in adolescence. Most adolescents don't want to be perceived as different. They want to fit in, and our sense of belonging is strong. And this evaluation occurs through a process of comparison with others perceived to be as similar along a relevant dimension, providing a benchmark for their own abilities, opinions, and overall self-worth. So there, as we know, with social media platforms, the careful curation of these profiles show an overrepresentation of positivity and really not a very reflection of reality. And that's what people are comparing to. So upward comparisons, those are unfavorable social comparisons. Of course, that leads to negative affective states and lower esteem. And when you compare downwards, or you perceive others to be inferior or less than, those comparisons actually make you feel better about yourself, of course. And there's a lot of research support, most of it cross-sectional, unfortunately, but a lot of research supporting social comparison theory. And we also know social comparison is a strong predictor of depression and anxiety. The more you compare, chances are the more you're comparing yourselves unfavorably to others, the worse you feel. So displacement theory is completely different, and it's basically saying it's not so much the content on the screen or the screen itself or technostress or overstimulation, but it's what we're not doing. It's all the activities that are displaced by high screen time. And there's quite a bit of literature to support displacement theory or behavioral economic theory. As I mentioned, sleep, there's strong evidence. Physical activity, there's moderate evidence. High screen use displaces in-person social activities with friends and family. It displaces recreational pursuits and hobbies and schoolwork and on and on. So two key concepts in behavioral economic theory are reinforcement and how youth reallocate their time to alternative behaviors or substitutes. So my old mentor, Len Epstein, is very well known for his reinforcement work, most of it regarding food. So we know snack food is a very strong reinforcer. It's a primary reinforcer. We need to eat to survive. And this stat is not so much surprising, but certainly marked and notable. So in the drug literature, snack food or sugar actually competes very well with drugs of abuse. But so what they did was they had a fixed ratio schedule on a computer, and youth were asked to basically see how hard they would work to get access to their cell phones versus palatable snack food. And you can see they're working way harder, almost 3 times as hard. This was just gauged by button presses through a fixed ratio schedule. So as the game went on, it became tougher and tougher to earn points for food and for snacks. So, so this shows how reinforcing cell phone and social media use really is for youth. So there's also inherent in this is the principle of substitutability, and this is what guides intervention. So if 2 reinforcers cost the same, humans will always choose what they prefer most. So coffee and tea are both $3 a cup. Coffee drinkers will choose coffee, and tea drinkers will choose tea. Simple enough. However, if the cost of coffee is increased to, say, $8 a cup, but tea stays at $3 a cup, many coffee drinkers will switch choice to consuming tea. So in this context, when you're restricting access to coffee via increased price, tea then becomes a substitute for coffee. People are switching their choice. And this is why it's called behavioral choice theory. So there's been a lot of literature using behavioral economic or behavioral choice theories mostly in smoking and addictions of other substance use, with very good evidence from well-controlled RCTs. And the key here is how in treatment is how best to reallocate the time. So when social media use is reduced, people have a choice of how they're going to reallocate that time. And that's really going to either drive or hinder mental health benefits. So if we're trying to reduce social media use and they substitute with Netflix, well, of course, you're not going to get a whole lot of benefit. You substitute with high quality time and friends, or pursuing hobbies, or physical activity, or walks in nature, of course, you're going to get more mental health benefits. So who is most vulnerable? We saw that in the meta-analyses, the overall effects when everybody's pooled together are not that strong in terms of social media and mental health. But there are some subgroups in which the relations do become a lot stronger. So the individual susceptibility theory has been around a while, and many researchers are starting to apply it. So it acknowledges that the effects of social media use and mental health are complex and nuanced. And like other environmental exposures, there are wide individual differences in the impact of social media use on health and mental health. And it posits the reason for that wide variability or individual differences is because the impact is probably influenced by a combination of sociodemographic, psychosocial, behavioral, and physiological and genetic factors, much like any other environmental exposures. Let's look at sociodemographic moderators. So we know underserved youth, or also youth from lower SES backgrounds, they tend to use screens more. They're more exposed to harmful content and cyberbullying. They may be a little bit more prone to unfavorable social comparisons. And research has shown that often they're saddled with babysitting and family-related tasks, and so they're engaging in less non-screen alternatives, which collectively increase their risk. This is not all that well studied. There are a few studies, and I'm looking at this in some population-based data with some colleagues, but SES and race and ethnicity are almost universally statistically controlled, but no one's examining whether this group is truly at higher risk, or is this just kind of emanating from all the research we know about social determinants of health. So this needs more empirical examination. One of the most reliable findings are that females are more negatively affected, especially when you're looking at depression and anxiety outcomes. So what I mean is, well, yes, there are higher rates of anxiety and depression in females, and they use social media more, but the actual relationship is stronger than in males. In our group and others have found that younger youth, age 12 to 14 youth, the relationships are stronger as social media and anxiety and depression. And Amy Orban published a review in Nature and found actually that age and sex interact. And there seem to be these developmental sensitivities around puberty. So females seem to be most affected around 11 to 13, and males seem to be most affected age 13 to 15. So there are these developmental sensitivities or critical periods. So as I alluded to, cyberbullying is a main mechanism. You spend more time online, you're increasing your exposure to negative experiences and harm and victimization. And this is a busy slide. I won't go through it all, but I will say that the prevalence of cyberbullying is about 25%. It is related with greater use. But those who are racially or ethnically diverse, it's about 35% of youth. People take liberties online that they wouldn't do face-to-face. And so what's interesting here is those who faced racial discrimination, social media, they were more likely to feel depressed and use substances, alcohol, and drugs, and also get involved with racial justice, of course. What's interesting here is relationships actually become stronger when you look at vicarious racial discrimination. So that is online through social media, discriminating against one's ethnic group or perhaps gender. Relationships, become stronger. So that's something that is not well studied and certainly needs to be further examined. So we also know relationships are stronger in those with existing mental health challenges. So clearly this is a more vulnerable group and more vulnerable to cyberbullying, more vulnerable to some of the what we call the dark side or toxic sides of social media. So what's emerging also is not only is it the quantity or duration of social media use, but how it's used is really important too. And the most widely investigated quality factor is passive versus active use. So passive use is just scrolling. You're not posting anything. You're not sharing content. You're just consuming, and that's reliably associated with greater emotional distress. Active or purposeful use actually is only weakly associated with emotional distress, and some studies even found it's associated with psychological benefits. Now, of course, most of this literature is cross-sectional, so we don't really know, is it how you're using it leading to mental health, poorer or better mental health, or people who we want to share their accomplishments. We know that's a big driver of social media use. They're excited to share their accomplishments, and so they're using social media more actively. But maybe it's sort of reverse causality there. So we have to tease that out better in well-controlled longitudinal research as well as experimental. So I certainly created a bit of a bleak picture here with social media and mental health, and that's because the literature reflects that. But I do want to note that there are some subgroups who tend to benefit from social media use. Youth really struggling with social anxiety disorder who can't get out much. There's some literature to suggest that they can benefit and feel a sense of connection online and develop some relationships that otherwise wouldn't be possible. Although interestingly, when those who get treated for that then find in-person relationships more fulfilling. Youth with autism spectrum disorder who have deficits with social reciprocity and social relationships also can benefit. But there's been a few interesting studies about transgendered and non-binary youth. Typically, these people really have adverse experiences online with these open groups, and when they use social media passively. They're strong targets for cyberbullying, and it causes extraordinary harm. But I wanted to share this interesting study from COIN. It was published in JAMA Pediatrics, and this is looking at active social media use, so purposeful use. And these were mostly probably closed chat, so just sharing with friends, not the open social media feeds. And you can see that actual high active use of social media with greater time. You see a reduced trend for emotional problems in both males and females. You can really see with the transgender non-binary youth, after 4 hours, there's a marked drop in emotional problems. So they're gaining support and so it's protective. And then the exact opposite trend is happening with all groups, with the transgender group. So when you're looking at intentional breaks, When they're breaking almost every day, then their level of distress is much higher in the transgendered non-binary group. And whereas, and this again is active use, whereas for females and males, the trend is actually decreasing with greater breaks. So so this is highlighting how you use it. Very strongly influences the impact on mental health, as well as, of course, your gender. And this study shows, this was a large epi study by Twenge, and it shows actually that if you have high social media use, but you have also high in-person social interaction, then your depression scores don't really go up compared to low use. However, if you have low in-person social interaction and you have high social media use, then the depression scores are much more elevated. So let's look at some experimental studies. I know I'm starting to run out of time. There have been some short-term abstinence studies, a big one by Tromholt, that was the first one. Of course, abstinence is not realistic for any length of time, but they do show proof of principle. So this was a bunch of Danish adult Facebook users, and they were told to abstain from social media for 1 week. They did do some checking. They provided access, and actual adherence was pretty good. And they found that the positive emotions, there was an intervention effect for positive emotions and life satisfaction with pretty good effect sizes. When they looked at whether envy, which is common online, actually found an increasing effect for those who are high, who had high envy at baseline. So interestingly, the passive users seem to benefit a little bit more than active users, and that makes sense. So you're reducing or eliminating passive use, you're eliminating all the harmful effects of social media. So this title might look familiar. There was an interesting study by Hunt that got a lot of press. This is a short-term RCT in undergrads. It was a 3-week intervention, and they limited social media use to 10 minutes a day on 3 platforms, so 30 minutes a day. That was their goal. They didn't achieve it, but it was still pretty good. They reduced, you could see, they reduced social media use. And this was objectively measured by screenshots. So every day, participants had to submit their screenshots. And you can see from the intervention group started at 300 minutes and by in baseline week, and then were a little over 100 or 125 minutes for the rest of the intervention, whereas controls actually increased their social media. So the manipulation was successful. And they found a reduction in depression with a stronger effect with those with higher baseline depression, as you might expect. And they also found a statistically significant reduction in loneliness at 4 weeks. Whereas looking at the controls, when you look at either high or low baseline depression and intervention, there was really no change. But this was the Beck Depression Inventory, a score of 5. There's a floor effect coming into play here. There's really not much room for reduction there. So this was an interesting trial by Abrailovskaya. That's fairly recent in 2023. So they randomized 642 young adults to 4 groups. So controls, reduce social media by 30 minutes a day, increase physical activity by 30 minutes a day, or combine reducing social media use and increasing physical activity by 30 minutes a day. I don't know why. So these are really busy slides, but basically the combined group. So remember I talked about the reallocation of time. So those who reallocated the reduction of social media use to and adhered to the physical activity recommendation. They had the greatest improvement in life satisfaction and subjective happiness, greatest reduction in depression, and greatest reduction in actual addictive social media use. And these effects were actually maintained over 6 months. So this is probably the best evidence that we have. Most of the interventions are short-term. So I just want to share some findings from our research, and then I will wrap up. So we modeled our study after Hunt. So we used objective measures of using daily screenshots of smartphones. And we targeted, unlike Hunt, we targeted youth who were, we did undergrad students who had emotional distress. So we screened for that. Almost all the youth were 17 to 19. We had very good compliance, 94% to the daily screenshots. We show a very similar pattern. So we reduced social media use in the intervention group from about 180 minutes to about 75. The goal was 1 hour per day, and we reinforced them every day. And that 1 hour goal was established in conjunction with the patient family advisory committee with the CHEO folks, and we did some focus groups, and they felt 1 hour a day was enough to stay connected and stave off FOMO, but still certainly leaving plenty of time for reallocation to other activities. So weirdly, our social media paper on body image actually got published before the larger paper, just because it went through quickly. And we found pretty significant effects. So there were, with reduction in social media use, the intervention group improved in weight esteem and in appearance esteem, and there were no changes with control. And then actually hot off the press, we just sent the proof backs this week as well, is the larger paper looking at broader psychological outcomes. And we found widespread benefits of the intervention group who reduced social media to 1 hour a day, reduced depression greater than controls. They reduced generalized anxiety greater than controls. And like the Hunt study, or unlike the Hunt study, although the trend was there, we didn't find that those with higher baseline depression, they didn't really benefit more. There was a bit of a trend. However, with anxiety, they really did. And this change on the GAD-7 scale, that's actually clinically significant too. It's about a 4-point change, which did meet the minimal clinical important difference. So those are pretty exciting findings, and it's highlighting, again, not everybody responds well to the intervention. Those with greater distress seem to do that. So fear of missing out, what happens when you ask youth to reduce social media use? So initially, anecdotally, they really missed it, but actually at the end of the follow-up, the fear of missing out, which is a strong driver of social media use, went down in the intervention group more than the control group. And consistent with displacement or behavioral economic theory, sleep went up spontaneously. We didn't tell them to sleep more. We wanted to see what would happen, how they would reallocate their time. And reduction of social media led to increased sleep. And we're actually we're writing a paper on mediation. Sleep was the main mediator for the mental health benefit of the intervention. So this, you may not be able to see, this is 45-minute difference. So intervention group slept 45 minutes more than the control. Loneliness also went down, not hugely, but it was statistically significant with reduced social media use. So we did look at social comparison. We wanted to see, those two main theories, and our data are much more consistent with displacement or behavioral economic theory. Sleep was the strongest mediator. There was a trend for reduced social comparison, but it wasn't significant. So our next steps, we just got with Marjorie Robb and our team, we just got a CHEO and RGA grant We're going to extend our intervention to 12-week RCT, and we're gonna have a much stronger behavioral intervention and reinforce individualized healthy substitute behaviors. It's going to be family-based, so parents are going to have to modify their own screen time and social media use, and we're going to look at neuroimaging and cognition and brain health, excuse me, in addition to all the other mental health outcomes. So in summary, so there's pretty strong evidence that social media use is causally linked to poor mental health and social emotional well-being, should be a target in treatment and prevention programs, which I know some psychiatrists and clinicians are doing it, but it is certainly not standard practice. Relationships between social media and mental health are complex, and some groups are either benefit or harmed more than others. We need more research on this. What we do know is that females, younger youth, underserved youth, and those who engage in more upward or unfavorable social comparisons or have less in-person social contact seem to be more negatively affected, as well as those with less time spent in alternatives. The how and why youth engage in social media use, passive versus active, seems to have an impact on mental health and well-being, and we need to explore that more. And we need to understand the motivation. You might remember from the earlier slides that almost 30% of people were not even captured. Their motivation was not even captured. And we do know motivation matters. And understanding the driver and the primary reasons you use social connection is very important to inform interventions. If we can understand what needs social media is meeting, maybe those needs can be met in other healthier ways, and that will tailor interventions. And I think we need more mechanistic work, see why, and to understand that theoretically driven mechanisms linking social media use with mental health. And there's a preponderance, we're starting to move away with it, but wearables are coming. There's a preponderance of literature out there, all based on self-report, which we know is not a very reliable indicator. So our group, and I know Mark Tremblay and plenty of other groups are starting to examine the use of wearables and passive biosensing to improve the precision and measurement of screens and social media use. And there's starting to be some policy changes, so there's an opportunity for some natural experiments. Quebec just had a school ban, a phone ban at schools, cell phone ban at schools. Ontario has one. Unfortunately, it's not very well. Implemented or enforced. But there's some action going on in the U.S. So there's an opportunity to really study at a population base these regions or provinces or states, and whether the reduced use actually is having the intended effect on mental health and cognition and learning. And of course, most of the RCT research, although encouraging, has been short term. So there needs to be more large scale clinical and community-based RCTs. So thank you very much for your time. I'd like to acknowledge my funders and my team. As you may know, there's behavioral intervention is hard work, and it certainly takes a team effort. And I'm certainly grateful to be working with all my wonderful colleagues, and it's been a pleasure supervising my students and postdocs. Some of the slides didn't have references. If you want, a special thanks to Marcus Bieber, who's my new incoming postdoc. So those references, if you just scan your QR code, you should be able to get access. Maybe give us another hour or two. I think a few are being added. Thanks very much for your time. I'm happy to take some questions.
Thank you. Thank you very much, Gary. That was great, fantastic. Just before we get to questions, a quick reminder for everyone to fill out the evaluation today. That's very helpful for Gary and for future and ongoing planning. Anybody have any questions? Maybe while we're waiting for people to put their hands up, Gary, I'll ask a quick one. What are your thoughts on, so pretty clear where the literature is going in terms of, the effects of social media use on, a lot of kids, whether they're vulnerable or just at kind of baseline health status. What are your thoughts on prevention in terms of, trying to push out or withhold kind of social media use for kind of these younger and early adolescents?
Yeah, it's a great point. And we know that the younger youth are more vulnerable. So I think it has to be multi-pronged. There's a role for schools to play. I think in education and digital media literacy, I think parents have to be really more involved. We know when they're more involved, that actually alters how youth use social media and how often they use it, which impacts their mental health. So I think schools, I think parents have to be more involved. There's got to be more systemic controls. I would love to see big tech being held accountable. They have these age restrictions, but it's so easy to bypass that. But there's also the risk of becoming, it's a delicate balance that we really need to figure out, because there's a risk of becoming the screen police, and it can harm relationships. But I think consistent with the displacement behavioral economic theory, I think honestly, starting young and getting your kids and finding their passion and alternatives. We know there's a strong inverse relationship between social media use and hobbies and recreation and schoolwork and physical activity and walks in nature. So whatever it is, it could be music, it could be anything that they find interesting. They have to get, and they have to model. They have to model it, and it takes work. It takes effort on behalf of parents, but they have to be engaged with their youth, and have to try to support those time spent in those healthy alternative or substitutes for screens.
I agree completely. Roger, you got a question?
Yeah, Gary, amazing job. I had a question regarding the interesting evidence you showed showing how an in-person social relationship led to better outcomes than virtual. And the question I had was whether the virtual was more asynchronous and passive. And I wonder if this is going to be a canary in a coal mine as compared to how we've removed a lot of inpatient care, especially for mental health counseling, and switched it to virtual. And I was curious if that has any foreshadowing of how a therapeutic relationships, in addition to just the social communication, works for that as well.
Yeah, excellent question. That's not well investigated, and certainly is really, really important. But I think that the slide, as you just captured nicely, certainly highlights that we feel a stronger connection in person. And I think there's wide individual variability. And maybe some of the nature of online interaction will, by definition, be asynchronous. People are busy; they're in meetings, they're in school, right? So there's not this flow right away. And I think timing of reaction does matter. Someone responds, I guess it's poor etiquette. They respond 2 days later. That can be perceived as very disrespectful and harmful, right? So really, this is a fascinating area that we really have to dig down deeper to and it speaks to how the interaction is used, how and why. I can tell you from personal experience, some of my clients actually want virtual therapy, but it's almost always in those I've seen for quite a while. So the rapport is there. Building rapport right from scratch with new clients, as I'm sure you've experienced and other clinicians, online, it's tougher. It's tougher.
Thanks, Gary. We're at time. I'm gonna just 30, if you can, I don't know if you can in 30 seconds or less. Sophia Ritzko is wondering if you can recommend a reliable scale or screening tool to assess social media use and what's being accessed and problematic use.
Yeah. So there are a bunch of validated social media scales, more addiction scales. There's the social media disorder scale that we've used. There's the Bergen scale. For those of you, I know my presentation went a little bit long, But for those of you who have any other questions, feel free to reach out to me. I'd be happy to email you these scales. They're short, they're 7 items, 8 items, and they parallel the DSM criteria for non-substance use addictive disorders like gambling.
Great. Thanks so much, Gary. Thanks to everybody for joining. I hope everybody has a great day, and we'll see you again.
All right. Thanks, Mark. Have a good day, everyone.